Good morning, everyone, and welcome to this EPF breakfast briefing. It's the last one for this year. My name is Kostas Alianis, and I'm Policy Officer here at EPF. Before I introduce today's topic, I want to remind you that this is an interactive format and that you can send us the questions that you might have at the email address that you can see at the bottom of your screen, or use the Twitter hashtag, #EU4Health, so that we can take your questions into account. Today's topic is the future of health collaboration at European level and the EU4Health Campaign that is calling for more EU action on health. This year has marked the launch of the discussion on the future of the EU with Juncker's 5 scenarios, and 2018 will be the year in which the EU financial framework post-2020 will be discussed. Health is clearly not a priority for the European Commission at the moment, as they are focusing on jobs and growth. And the question is, will health be a priority post-2020? There was a growing concern from NGOs working in the European public health sphere that the collaboration on health will not be the same as it is right now, and will maybe even diminish or be dismantled completely in the future. And as a response to that, we started the campaign EU4Health, together with the European Public Health Alliance, and that is what we'll be discussing today with our guests. So good morning. We have Zoltan Massay-Kosubek, the Policy Manager for Health Policy Coherence at the European Public Health Alliance, and Camille Bulot, our Director of Operations and Engagement here at EPF.
Good morning.
Good morning.
Good morning. Thanks for the invitation.
Thank you for being here. Camille, maybe I can start with a question to you. What was the background of this campaign and what was the rationale behind it?
I think there were several reasons that prompted us to initiate this campaign, but one of them was what you mentioned in this introduction. As you recall, in March 2017, the President of the European Commission, Jean-Claude Juncker, presented 5 options for the future of the European Union, and they were really different scenarios. One of them was carrying on with the European Union as it is. One of them was focusing on the single market, and I'm not going to go through all of them, but one of the other scenarios was doing more on less topics, and that was the only scenario where health was mentioned as one of the potential topics where we could do less as the European Union. So that was the first trigger and really the first concern that we got. The second one was that we gathered some advocacy intelligence suggesting that there was a practical exercise going on internally within the European Commission, and suggesting that one option was a potential dismantling of DG Santé, Directorate General for Health, within the European Commission, and also the discontinuation of the health program. So that was a second worrying signal for us. And finally, over the past few weeks and months, we saw the emergence of the approach calling for health in all policies, which is a really good one. If you ask me, this is really something we favor. It's really the mainstreaming of health policies in all the different policy areas. But it should not mean that health is watered down, and certainly not mean that health ceases to exist as a standalone priority. So we call for really a dedicated DG Santé that can lead the action on health as a standalone priority and also as a mainstream priority in the different other policies. So as a result of these 3 items, we felt it was our duty to really call for the continuation of the health collaboration at EU level, and that's why we started this campaign.
Yes, that sounds indeed quite worrying. And Zoltan, maybe you can tell us a bit more about what the idea of this campaign was and what you're trying to achieve with this?
This is a very important campaign, and actually we try to stress and explain that health is one of the biggest success stories of the European Union. Health actions manifest in several ways. But we can list quite a few concrete EU actions in both the area of healthcare, when the EU has a complementary competence, and in the area of prevention, when actually the EU has quite a strong competence, which demonstrate the EU added value on health. In the area of healthcare, for example, there is a EU law regulating the movement of patients. So every one of us know that famous EU insurance card. So you travel abroad, then you shouldn't worry about your healthcare coverage. The EU also regulates the professional qualification of doctors and nurses, so they can move within countries. But also there are EU regulations on pharmaceuticals and medical devices, vital products to protect our health. In the area of prevention, it is also very vital when the EU can keep us healthy. One of the biggest EU success stories is the famous Tobacco Products Directive. The product as a product is regulated at EU level. Due to the EU commitment, you will have larger pictorial warnings, you will have strict regulations on that, which should decrease smoking and the related death to that. But there are vital health benefits in non-health policy, and that's also the key. Look at the air pollution policy. EU law set down minimum emission levels, which could actually bring down air pollution and link deaths and sicknesses, which is absolutely vital. The same goes to road safety, where the EU regulation protects and makes our everyday travel, cross-border travel, even safer. Or in the social policy area, there is an EU framework for excluded community, the Roma. And that EU framework has also a health dimension, so the health should be ensured there. So all of those achievements are vital, are bringing health benefits, saving lives, and we should raise awareness of that. I think that's one of the core ideas of our campaign. We also wanted to raise awareness, as Camille, you pointed out, the health program, that it exists. That it is at the core of the EU actions, and it enables the Health Commissioner to being a leader on that issue. And as being citizen organizations ourselves, we wanted to mobilize European citizens, European NGOs on that topic.
Thank you, Zoltan. Can you also maybe tell us a bit more about what the concrete actions were of the campaign up until now?
Sure. Camille pointed out our initial step, the first letter we have sent to Commission President Juncker. So we initiated a meeting with them, and we gave an indication about the health success story. So we started a conversation with him. We also decided to open up that letter as a petition. So now every organization is able to sign it and to support our campaign. And as far as I'm speaking now, we have gathered 234 organizations supporting our cause. That includes patients' organizations, public health organizations, but also social NGOs, environmental NGOs, trade unions, the members of the business community, and the academia, which is also very important. We also launched it via social media. I think also this is the hashtag of that conversation, EU4Health,
Exactly.
where citizens and stakeholders can express their support of our cause. And as being EU-level actors, both EPF and IFA and all the organizations supporting us, we try to implement it in our core work. We organize events, we follow policy areas, we meet stakeholders, and I believe we didn't miss any opportunity to raise the importance of health cooperation at EU level.
Yes, thank you. Camille, maybe based on the actions that we have done, you can tell us a bit more about what the reaction has been from the European institutions?
Yeah. So first of all, I think in the public health community, as Zoltan was explaining, the support has been tremendous, and that really deserves to be mentioned. With regards to the institutional reaction, so we got a reply to the letters that we sent to the President of the Commission saying that he could not meet us for now. But we also got some messages from the European Commission through public interventions from the Commissioner Vytenis Andriukaitis and also from the Director General of DG Santé, Xavier Prats-Monet. And the messages we got was really denying that health policy was in the process of dismantling, which is quite good news. And then we also got some pushback saying that the reason why having some pushback, saying that really member states have the competence in health, and that's one of the reasons why the European Commission is not proactively seeking to continue on this topic. We also got, and that's valid for all of the policy issues, the need to prove the added value of health. And on that, we'd like to comment, because is it really, first of all, the concept of added value is quite subjective. And second of all, is it really for NGOs to demonstrate the added value of public health, or is it for the Commission to really show the added value of their action? So that's really what I wanted to say. In the last week, we saw a change of narrative, though, which is quite positive. So we're moving away from the fact that the EU doesn't have the competence to act, to a narrative where the Commission is saying we will see what we can achieve with the competencies that we have, which is quite positive. From the member states' perspective, we saw the support of a number of member states who perceive really the added value of health collaboration at EU level, and also the importance of the health program, and they even stressed that it is underfunded at the moment. Finally, with regards to the European Parliament, the members of the European Parliament have not signed our statement, but they have started their own initiative under the leadership of MEP Kovacev, and a number of four members of the European Parliament who have published a statement calling for continued health collaboration at EU level and expressing their concerns over the fact that it could be dismantled. And this statement has so far been signed by 80 members of the European Parliament, showing that this is really a cross-partisan initiative.
Thank you, Camille. So Zoltan, if I can come back to you. We have had some actions from civil society, we have had some reactions from the European institutions. Does that mean that the campaign is over, or are you planning on continuing and having some further actions for the future?
Actually, we consider our campaign as a starting point of a wider movement, of a wider call to action, actually, because Europe is in a turning point, a vital moment. The future of Europe is at stake. The European Union might not be the same as we know it now, post-2020. And maybe I'm not exaggerating when I'm saying that even the European project, the European dream is at stake if we forget about our values, if we forget what is about the EU itself, and if we do not care about their importance. And I think this is a vital moment, and we have to act on that, because as I explained earlier, health is among the key achievements of the EU, and it is within the treaties that the European Union is about improve the citizens' life and well-being. So the whole internal market is set up to pragmatically make citizens, to give citizens a better future. So that's why we think that we have to continue that campaign. We have a role to play, and as we are now, the EU budget negotiations will enter in a key moment. So we will focus on that. We will monitor the developments, and as we cannot stress enough, the health program, the future of the health program, should be something which I think the whole public health community and citizens need. So this is something we have to continue, and we will make sure that each aspect of the budget will pay due attention to health. We will also continue to collaborate with citizens. We will continue the social media campaign with the EU4Health hashtag. And just to make the case, we also plan to give a concrete overview. I have explained today some examples which we can pick up, but we would like to give some kind of overview in a concise document in which we can then present to stakeholders to demonstrate what I have said, that the EU indeed brings a real added value to citizens' health, and we are determined that our actions will succeed.
Thank you. That sounds very convincing. Camille, do you have any reasons that you give to our audience why they should care about this campaign?
Mm-hmm. I think they already care, actually. If you look at the Eurobarometer that was published earlier this year, we see that 70% of EU citizens want more health at EU level. So that's a clear sign as well for us that we are going in the right direction. What can I say? Health collaboration at European level is really important. There are many things that can happen only through health collaboration at EU level. That's inspiration from each other, from one country to the other. And we see that within our respective memberships, how you can really draw on the best practices that are developed by the different organizations in different countries. I think that's the same for the member states. You can really pick up on what is being done in one country and replicate it in another one. Research only makes sense at European level at this stage, and the development of standards is also very important. And about shared competence between member states and the need really for and the argument that member states do have only the competence to act. I think this is not true. There is really a lot that can be done with regards to health protection at European level. And think of it like a little bit like gender equality. It's not because you're giving more rights to women that you're actually depriving men from their own rights. You're not taking anything away from them. So I think it's the same with health collaboration and action in the field of health. Empowering the European Commission and the European Union and doing more for health protection at European level doesn't mean you're taking anything away from member states. At the contrary, I think it's really mutually reinforcing actions that we need to pursue.
Thank you. I think that Camille has convinced our audience on the importance of this campaign. Zoltan, do you have maybe some concrete actions that they can undertake, some concrete examples of what they can do to support the campaign?
Actually, yes. As you have witnessed, we run and we have a European level campaign. But in order to succeed, I think we need member states level campaigns. We need citizens and at national level to raise their voice and to speak more about health to national decision makers, because at some point of time decisions about the budget, about the future of there will be taken also at member states level. I think our health commissioner and respectively health ministers are convinced about the importance of health. So what we should and citizens should do is to turn to those who needs to better understand the importance of health. I'm talking about in the national governments about finance ministers, prime ministers obviously, or national members of the national parliaments who they have to be informed about the EU added value. And if we talk about GDP, economic growth, that's also important to explain the health aspects of it. Because jobs and growth, which is quite important for economic prosperity, cannot be achieved with a sick population. So if Europe forgets about health, then it can compromise its competitiveness. So we also therefore encourage citizens to join our social media campaign, to raise their concerns and support our cause. We are calling organizations, not only health, but other organizations also, to go to our campaign page and to sign our still ongoing petition, which will be very helpful, because only if we show a united, strong voice coming from the ground can be convincing enough for the Commission and for member states to ensure that health will be at the heart of Europe after 2020.
Mm-hmm.
Definitely. Thank you very much, both. Thank you for your time and thank you for being here. I hope we have convinced our audience of the importance of the campaign and showed them how they can do more. This video will be made available on YouTube later this day. And I would like to welcome any feedback that you might have, as this is the last breakfast briefing for this year, so that we can see how we can improve this platform and how we can provide more useful information to you in the future. So thank you very much for watching and have a good day.